Good afternoon. I'm Hannah Wiley, politics reporter for the Sacramento Bee. Thank you for joining what I hope and expect will be an engaging discussion on California's COVID-19 vaccine rollout plan. Though far from a silver bullet to end a pandemic that's infected more than 1.5 million Californians and killed 21,000, the COVID-19 vaccine is considered the most powerful tool to help end this crisis. And it couldn't come at a better time. Vaccination in the United States began Monday, at a time when the country is shattering new case records on a near daily basis. Hospitals are stretched to a breaking point, ICU beds are full, people continue to die at alarming rates. California, too, is experiencing a critical moment. With most of the state under regional stay-at-home orders due to surging COVID-19 numbers, the vaccine's arrival has brought with it something many of us haven't felt since March: hope. Joining me today for a COVID-19 vaccine question and answer session is Dr. Richard Pan, a state senator representing the Sacramento region, a pediatrician and author of California's legal vaccine requirements for school children, and Dr. John Belko, a pediatric infectious disease specialist at the Kaiser Permanente Roseville Medical Center. Thank you both for joining us. I'd like to jump right in, as we have so many questions to get through today about this historic moment in our country and state's history. Some questions come from our readers, others I'm curious about, and we'll also take questions at the end from the audience. But I'm just going to dive right in. Up to 2.1 million doses of COVID-19 vaccine from Pfizer and Moderna are expected to arrive in California before the end of the year. But in a state of nearly 40 million people, obviously some are going to have to wait until next year to get vaccinated. So who will be prioritized in this first phase of the vaccine rollout and why? And Dr. Belko, would you like to take this first question?
Sure. In partnership with the Centers for Disease Control and the California Department of Public Health and our local county health departments, we are following their guidance in terms of which populations to immunize first. First on the list will be populations of persons at risk of exposure to SARS-CoV-19 through their work in direct healthcare or long-term care settings. So that means hospital workers on the front line, anywhere from doctors, nurses, to EVS workers, technicians, that sort of thing. Also to long-term care residents and workers in long-term care facilities. And then if there's enough vaccine in the first allotment to get through those groups, then they'll actually expand the rings out from there.
Great. So Elizabeth Del Sol asked, I belong to Kaiser Senior Advantage. When can I expect to receive the vaccine, since I'm in the 70 plus age range? So when should she expect to get that vaccine? Dr. Belko, do you want to answer that again?
I can try. The honest answer is we don't exactly know yet, because it depends on how much of an allotment we actually get. I anticipate it probably will not be until some point next year. It may be as early as February. It might be as late as March or April.
And then Dr. Pan, there have been several questions about, what if I've already had COVID-19? Should I even get vaccinated? And then another question similar to that is, if I get vaccinated, do I have to continue wearing a mask? Do you want to tackle those two?
Sure. Yeah. I just want to start off by saying we have about 2.1 million healthcare workers in the state of California. So when we think about the order in which people get vaccines, just sort of keep that in mind. If you've had COVID, and unfortunately so many people have had COVID, actually you should still get the vaccine. And the reason is that even when you've gotten infected by this virus, the way your immune system responds to that virus is that it's reacting to the entire virus. The vaccine itself actually causes you to produce a protein that's very specific to the virus in terms of its ability to be infectious and to invade your cells. So it's a very targeted kind of approach. And in fact, people who've had COVID are still at risk of potentially getting reinfected. and that your immune response to the entire virus may not necessarily be targeted toward the part of the virus that's most infectious. So currently the belief is that people who had COVID should still get vaccinated against this disease to be sure that you mount an immune response specific to the particular protein that makes the virus most infectious. Now, there's been some debate whether, for example, people who had COVID within the last 90 days, whether they should perhaps wait, because you do tend to have fairly good protection after you've been infected by the virus for at least the first 90 days out after you've been infected. And since those people are less vulnerable, let's try to get other people earlier in line. However, the belief right now is that given what we know about the virus, that people who did have COVID should still get the vaccine eventually to get better protection.
And I'm going to stick with you here, Dr. Pan, because you've had many an experience with vaccine disinformation and misinformation. So many readers have this question: is the COVID-19 vaccine safe and effective? An Instagram user named Mad Church asked if they are trustworthy and if everyone should get them once they can.
So I'd say is that these vaccines have undergone clinical trials of tens of thousands of people. So by the time you have an opportunity to get the vaccine, you're certainly not first in line to get the vaccine. And in addition, even after approval, we're constantly monitoring the vaccines to see if there's any potential issues that may come up. So if you think about it, not only the tens of thousands of people initially get the vaccine for the clinical trials, we're of course putting healthcare workers first to protect them. It is safe and effective. But we'll also have even more data. So by the time it gets out to the general public, millions of people probably would have already had the vaccine. And you can feel confident at that point that when you're getting your vaccine, that it's safe and it works.
Dr. Belko, do you have anything to add on the safety of the COVID-19 vaccine?
Yeah, the clinical trials are designed to actually look for significant safety problems early. That's why they actually have phase 1 and phase 2 clinical trials. Phase 3 clinical trials start to get some preliminary information on efficacy, and that's sort of what the FDA uses as guidance to sort of move forward to the next step with approval of vaccinations. So I feel very comfortable with the data that we have from the vaccines. There have been almost 400,000 individuals that have been enrolled in different clinical trials around the world. So I feel like we have very good, robust data in terms of safety. So, yeah.
Great. Now, where will the vaccine be administered? And then once somebody does get vaccinated, what does the tracking process for when they will return for that second dose? Because both companies, Pfizer and Moderna, require 2 doses. But what does the tracking of the vaccine process look like? So where will the shots be administered, and how do you know when to come back? Dr. Belko, do you want to take this one?
Sure. Generally administered in the deltoid, or which is in the arm. For in some situations where it can't be administered in the arm, it can be administered in the anterolateral thigh, which is in the leg. In terms of tracking, there are a number of mechanisms that are involved in tracking. In our organization, or for those organizations that have an electronic medical record, there is a mechanism in that record to notify patients when to come back to get their second dose of vaccine. There will also be some outreach to individuals who are going to be getting their second dose of vaccine to make sure that they can come back in time to get it. There are different layers to that. So some of that will be phone calls, some of that will be messaging and trying to get a hold of people to make sure that they come back.
And I can add to that, actually.
Yep.
First of all, we're on the brink of having the Moderna vaccine also approved. And so if you get one dose of one vaccine, you have to be sure you get the second dose of the same vaccine. So you can't switch the different products. However, the state is enhancing its immunization registry as well. So when you get the vaccine, you get a little card that says which vaccine you got that you have. Now, I know some people will lose their card. They may, but if you still have it, then that will be proof of your vaccine and the date, so they'll know when it's appropriate for you to get the second vaccine and which vaccine to give it to you. But in addition to that, I think as Dr. Belko mentioned, we certainly have our health systems are tracking this, and then the state as well, through its immunization registry, is also going to help provide some tracking so that we can be sure people get their second vaccine on time and to get the right one so they can get fully protected.
That was going to be another question I had is, if I get the Pfizer vaccine to start, why can't I get the Moderna vaccine for my second dose? Do you want to continue on that thread, Dr. Pan?
So while they both use sort of similar technology, they've only been tested for basically getting both of the same vaccine. So we don't know what happens if you get a Pfizer vaccine first and then a Moderna vaccine next. And so that's why it's so important that given the data and information we have, you really need to be sure you get the same vaccine for both doses. And certainly we are putting in the systems in place to help remind people, and of course, giving people the information they need to be sure they get the right vaccine for their second dose.
And where should I expect to get the vaccine once I'm eligible? Where should I go to my pharmacy? Will I be able to go to my doctor, Walgreens, CVS? Where am I going to get these shots? Dr. Belko?
That's a good question. I think to some extent that's still in evolution. For the first rollout and probably for the second, it'll be done at sort of our local medical centers, distributing it to healthcare workers. And then as it rolls out to our membership, it will likely be a mix of getting the vaccine within our organization as well as at local pharmacies. I know that CVS and Walgreens have been partnering in order to be able to distribute and to provide vaccination. So I think we'll hear more about that as time comes forward for that to happen.
Yeah, if I can just add to that, the state is still working on those plans, but the basis of the plans is using sort of the traditional sources of vaccination, which are pharmacies and clinics and doctors' offices. But I also want to point out that because in some communities, they may not have as many pharmacies or practices available, the local departments of public health will also be involved in setting up vaccination centers to be sure that vaccines are available and accessible to everyone in the community, particularly most vulnerable communities, the places where people often have less access to care as well.
Yeah. Now, speaking of logistics, Tahoe ER nurse Dorothy Dean asked how we can ensure the Pfizer and Moderna vaccine vials are continually kept at the necessary low temperatures. Dr. Belko?
Well, I could start that way. When it's shipped from the company, it's shipped under specific conditions and it is monitored. And when it arrives at the location that to be distributed at the state or at the county level, that cold chain is continued and you can actually track those temperatures and it's charted as it kind of goes through to get to the end user. Once it gets to the end user, so for example, at Kaiser, it gets stored in a freezer that is actually centrally monitored so that if there's any problems, we know about it and we can intervene before we lose that stock. And then there are instructions that we are given by the companies in terms of how to thaw the vaccine on the day of administration and how long it can be at what temperature in order to still be available for injection.
Okay. And I think this just raises the overall question of how are vaccines made, and in particular, how was the COVID-19 vaccine made? In layman's terms, how do they work? We've touched on this a little bit, but can we break that down a little bit more? Dr. Pan?
Sure. So I should point out that these vaccines use a technology that's been developed for over a decade. So basically what the vaccine is that it contains a substance called RNA, which is sort of like a blueprint of how to manufacture a protein. And the protein is telling the cells to manufacture is actually the spike protein on the virus that makes it particularly infectious. I would point out that this RNA is very fragile. That's why the vaccine has to be kept so cold to be sure that this RNA remains intact. I should also point out that it only codes for that particular protein. So you can't get COVID from the vaccine itself. It would be as if I gave you a blueprint for a steering wheel and then you had to build a whole car. You couldn't build the whole car from just this steering wheel blueprint. So then what happens is that when you get the vaccine, that RNA is taken up by the cells that produce that spike protein. And then when that spike protein is in your body, your immune system actually learns to identify it like it's like a wanted poster. So So now can recognize it and then actually react to it. So you have cells that will destroy other cells that are infected with that has that protein. And also you have antibodies that will actually stick to that protein to prevent a virus with that protein from being able to invade. And so when you get the vaccine and your immune system has a chance to respond, when the real virus shows up, the entire virus, which will have these spike proteins, the antibodies will stick to it, so it can't actually invade your cells as well. And then also any cells that are attacked by the virus, your immune system will clear them out, and therefore you will be immune to the virus. And that's how the vaccine works.
Was there anything that you wanted to add to that, Dr. Belko?
I think that's exactly right. I think the key feature here that people have to understand is that this vaccine isn't actually going to give you an illness. This vaccine is going to introduce the production of a protein that is going to trigger your immune system to kind of respond to it. And in that fashion, as we all kind of think about it, when our immune systems respond to different things, that also involves causing symptoms. That means it wouldn't be unusual to have a little bit of achiness, a little bit of a sore arm where the injection was given. It wouldn't be unusual to have a little bit, potentially even a low-grade fever associated with that. And that's because that's a sign that your immune system is actually recognizing that there's something foreign there that it's responding to and building antibodies to that, so that when you're really exposed to COVID, it can help prevent you from getting a serious infection or getting infected.
That was going to be another question I had. I mean, when I got my flu shot this year, I had a little bit of soreness in my arm, but nothing more than that. But I'm assuming we can expect the same from the COVID-19 vaccine, side effects. Can we touch a bit more on, I guess, the extremity of the side effects, and then also the difference between the possibility for adverse reactions? Dr. Pan?
Sure. So as you pointed out, that oftentimes people do get side effects when your immune system responds to the vaccine, just like it would if you would have those similar symptoms if it actually had to respond to the actual virus, right? So you could have some fever, achiness. I think with this particular vaccine, they talk about fever, headache, muscle aches. And sometimes they can even be, for some vaccines like the COVID vaccine, they may be severe enough that you may feel like you can't go to work the next day. But what the studies have shown, the clinical trials, is that these are all transient. Okay, these go away, and there's no long-term effects. In the trials, they required people to be followed at least 2 months after they got the second dose of the vaccine to be sure that there were no other adverse events or side effects that you need to worry about in terms of safety. So I think we can feel comfortable that, yes, you will potentially have some symptoms. Actually, majority of people don't, but some people do. You may even have to miss work the next day. But the trade-off is that you are now protected against a virus that unfortunately has killed over 300,000 Americans.
Great. Another good question. A lot of people are confused by the term herd immunity. And can we put it into context? Why is that concept important to this conversation? Dr. Belko?
Sure. When most of a population is immune to an infection, that provides indirect protection or herd immunity or herd protection to those who are not immune to that specific disease. For example, if 80% of the population is immune to a virus, that means 4 out of every 5 people who encounter someone with the disease won't get sick and thus won't spread the disease any further. And it's in this way that the spread of infectious diseases is kind of kept under control.
Dr. Pan, did you have anything to add to that? I know this was a key topic with when we were discussing schools last year and regulations in schools.
Right. So there are going to be a certain percentage of people who can't get vaccinated against this virus, right? So there may be some people who are allergic to certain components of this vaccine who cannot get it. We don't know in terms of ages whether there are probably going to be some children who are too young. Right now, the vaccine's only approved for people 16 years and above. They're doing further studies to see if children can get it, and there's no indication why children probably couldn't get this, but of course we need to do the safety studies. But there may be, again, there may be an age range where kids are too young to get it. And again, there may be some people who also are immunosuppressed, so they don't mount a sufficient response to the vaccine, so it's not as effective. And in order to protect all those people, the rest of us being vaccinated helps protect them. So when you have enough people who actually are immune through being vaccinated, then the virus has no place to go, and therefore it doesn't spread through our community. And I personally like the term community immunity instead of herd immunity, because it really is about this shield that we're creating in our community when enough of us get vaccinated. And I think with COVID, they're thinking that that's probably going to be about 70 to 80% of people vaccinated, given how infectious this virus is.
On that point of which populations can and can't get the vaccine yet, this, from my understanding, correct me if I'm wrong, but the vaccine has not been tested yet on pregnant women, correct? And so when can expecting mothers, when could they get vaccinated? I'll leave that, whoever wants to talk to that.
So what we've been telling, what the American College of Obstetrics and Gynecology has come out and said, that if you have someone who is a member of a risk group that happens to be pregnant or lactating, then they should be offered the vaccine just as if someone was not in that same risk category who was able to get the vaccine. So essentially what they're saying is the benefits of vaccination in someone who's pregnant or someone who's lactating or breastfeeding outweighs the risk if you're actually working in like the healthcare field or working with individuals or having a high risk exposure job to COVID. So they would say that discuss that with your obstetrician, see how they feel about it, talk about what your risks are based on what you're doing, and then assess to see if this makes sense for you to get the vaccine.
Did you have anything to add to that, Dr.
Yeah, I guess I would say, they didn't test this vaccine in pregnant women in the trials, and that's not unusual. When you first test a new medication or vaccine, you generally first go for essentially healthy adults, right? That's why we haven't tested it in children yet. There's nothing about the mechanism of the vaccine that would make us think it would pose a particular risk to pregnant women. So that recommendation from ACOG is sort of balancing off what we know about how the vaccine works. But also, we are going to continue to collect data on the vaccine, including for those who are pregnant women who choose to get the vaccine. And so hopefully we will have more data, both from trials and from monitoring on the safety of this vaccine for pregnant women, lactating women, and children as well.
And Sue Stone asked, my 88-year-old mom lives in an independent senior community. I'm worried about the safety of the vaccine for her. Was it tested on the elderly?
Yeah, this vaccine did include populations at risk in older population, and the vaccine worked very well in that age group. So we don't have any reason to have any concern about utility in that age group. So essentially, it's safe for mom to get it.
Great. Let's see. This is a good question, just because I myself fall into this category. But how early will the non-high risk 20 to 4-year-olds have access? So when can I expect to get vaccinated? I know there are a lot of factors at play, but what do you anticipate, Dr. Belko?
Depending on how many vaccines come online and what the supply looks like, it might be as early as May, maybe even late April, but it's really hard to sort of guess that at this point in time.
Dr. Pan, do you have a guess?
Well, no, it really is about the manufacturing of these vaccines. So first of all, it is exciting that the Moderna vaccine, I think today FDA, the scientific committee has approved it, or they signed off on it. So then hopefully we'll get FDA approval soon. So there will be 2 vaccines that are available, but it really is about the manufacturing process and how many vaccines they can manufacture and then distribute across the country. So yes, we're trying to prioritize people at the highest risk. But if we have enough vaccine, we're going to be able to eventually get to everyone who needs it. And so the question is, how long is it going to take to get there? All depends on the amount they're able to manufacture and then distribute throughout the United States and the world. Keep in mind that this is a global pandemic that's affecting people around the world.
Yep. So speaking to that, when we all eventually are eligible to get vaccinated, when might we expect restrictions to start lifting? When might it be safe to go to spend a holiday with our families? When might it be okay to go to a wedding? And next summer, there are going to be live shows scheduled so far, some music festivals. Do you think I'll be able to attend any of that next year?
Well, let me, I must first of all start off by saying that the vaccine, it's really exciting that we started yesterday and today. It's going to be several months before we get enough people vaccinated, maybe even out into the summer. In the meantime, we all need to do our part to stop the spread of this virus. I will point out that there are other countries without a vaccine that are having concerts and people going to restaurants and kids are going to school. Countries like Australia, New Zealand, Taiwan, because in those countries, they have expected that people do the things they need to do, which is like wear their masks, keep their distance, not mingle in households, until they actually drove the number of people with the virus, the amount of virus in the community, to a very low level, or essentially zero, right? And that's what our first task is. So it's very exciting the vaccine's coming out. The vaccine will help a lot when we're able to vaccinate enough people in our community. But in the meantime, we are seeing cases rise. We're really concerned that our ICUs are going to get overrun here in California. It's already happening in the rest of the country. So I guess I would just say is I beg you, while we're waiting for the vaccine to come for the for the general population, we all need to do our part. This holiday, please don't mix households. Please wear a mask when you're with anyone outside your household. Please try to keep your physical distance. We need to do what we can now. We have to see a light at the end of the tunnel, but we're still in that tunnel. And we need to be sure that we try to save as many people as possible so that when the vaccine is eventually available, that they can get that protection. The vaccine won't help anyone who gets sick and then dies of this virus over the next several months. So let's do what we can to stop this virus now.
Dr. Belko, do you have anything to add on the timeline that you're anticipating?
I am anticipating it's going to be later as well, but I have to also completely echo Dr. Pan's sentiment that this really is about not just the vaccine, because the vaccine's just one cog in our response plan. The other cog has to be, we still have to continue to wash our hands, we still have to continue to socially distance, and we still have to continue wearing our masks in public, and we still need to be mindful of gatherings. So again, I'm going to echo what Dr. Pan said, is just please, please, please be mindful, because he's right. Getting the vaccine isn't necessarily going to help you if you're suffering from COVID and dying now.
So when here in California, we do have a mask mandate and we have restrictions against certain gatherings. My question is, can we expect a vaccine requirement down the pipeline, and maybe what sectors might we expect to potentially require that immunization in order to maybe go to work or go to school? Is there any of that possibility in the future? And Dr. Pan, do you want to speak to this one?
Yeah, first of all, at the beginning, we won't have enough vaccine for everyone who wants it. So I'm not so worried about mandating vaccines for anyone, because we just won't have enough vaccine for everyone who wants to get the vaccine. And appreciate the fact that as the vaccine's going out, actually a higher and higher percentage of people are expressing that they want the vaccine. Now, there is always a possibility that private entities, businesses, and other entities that are concerned about spread of this virus within their own businesses, its impact on their own ability to operate, may consider having certain requirements for vaccines for people in terms of their own operations. That's a decision by private businesses. There are certainly some laws that may affect their ability to do that. But I don't see at this point that we would have a sort of a government mandate on receiving this COVID vaccine. I think the real challenge is getting the vaccines out to all the people who want it. And certainly anyone who is looking around and seeing what devastation this virus is causing on our friends, our neighbors, our family, our communities, the fact that our kids can't go to school, that our businesses are closed. Anyone who cares about those things should be saying, please, please, please give me the vaccine as soon as I can get it. And I'll go wear my mask and keep away from other people in different households until I get the vaccine.
Well, I mean, even after you get the vaccine, we're
Sure.
still going to continue to wear masks and socially
True.
distance, because it really isn't until we get to a larger population immunized and then we have good evidence that we're able to control the spread of disease better before we can actually start to say, okay, we can relax and remove the restrictions that we're all not so thrilled about.
I have to agree with Dr. Belko there.
Me too. Now, in the state's plan to vaccinate as many people as possible who are interested in getting the vaccine, Governor Newsom today talked about the importance of building coalition and collaborating with local faith groups and community leaders, et cetera, to build trust in the vaccination process. I'm eager to hear both of your recommendations on that front, but Dr. Belko, what is going to be critical for the government to do, for local leaders to do, for nonprofits, faith organizations, et cetera, to encourage people to take this vaccine?
From my perspective, I think going out and reaching out to specific ethnic communities and speaking to them in their language, hopefully from health leaders in their community to actually be able to be trusted and listened to, would be greatly beneficial. We have seen those interventions work in sort of the Russian-speaking community and also in the Spanish-speaking community. That's really worked really well to kind of bolster sort of uptake and adherence in terms of coronavirus disease itself and mitigation methodology. The trouble is that when you're doing it in English or when you're doing it in venues where not many of them are potentially listening or not participating in, that message doesn't always get to those smaller insular communities. So doing direct reaching out to those communities is going to be very important.
Dr. Pan, do you have anything to add?
Oh, definitely. I certainly agree with Dr. Belko, and that's the state is working on plans to figure out how do we reach a variety of communities to educate people about the vaccine and its risks and benefits. We need to acknowledge that there are many communities who have good reason to distrust the medical community based on past history, and we need to have that dialogue. Also, it's really important that health leaders, including healthcare providers, doctors, nurses, other people, receive accurate information about the vaccine so that they can counsel their patients. They're often, many times people do, ask questions of their doctors and nurses and other healthcare professionals. And so we need to be sure that information is out there as well. And certainly events like this one, so that we can get answer people's questions. It's fine to have questions, just please listen to the answers. And we are getting data to be able to demonstrate to people that the vaccines are safe and efficacious, and that people should be able to trust getting the vaccine.
So you just said an important word, which is efficacious, and I understand that that's different than effective. Can somebody explain the difference between the two? Dr. Pan?
Well, so basically what the trials show is that that 95% of the people who got the vaccine, 95% basically get protection from the infection. I would also make note that, at least in the trial data, that even people who got infected with COVID after getting the vaccine, generally their cases were milder. So, for example, I think the Moderna vaccine, which was just reviewed by the scientific panel, there were all the cases of severe COVID that led to hospitalization happened in the placebo group, the group that didn't get the vaccine. So that certainly, those are all very positive signs about how well the vaccine can help protect people. So even if you do catch COVID, despite having a vaccine, it does appear that the infection is more mild. And again, if we get enough people vaccinated, that also limits the ability of the vaccine to spread in the community. And so the chances of any particular person actually getting COVID will start going down if we can prevent this virus from spreading in our communities. And that's why vaccines are part of that answer, but also, wearing the masks and keeping the distance. And I think that's why Dr. Belko, and I agree with him, said that even once we are starting to vaccinate people in the community, it's still important for people to do that until we get enough people vaccinated in the community at large.
Anything to add on the two terms, Dr. Belko?
I'll just piggyback or dovetail a little bit and say that I think the studies are very encouraging and they had very great data, but the most important piece that the CDC does is they actually do sort of post-authorization constant monitoring. So the company are now tasked with sort of monitoring everybody who's been immunized, and the CDC is going to be helping doing that as well in order to kind of figure out what the real world efficacy of the vaccines are. So what that means is, as we're immunizing individuals, they're going to be getting follow-up. They're going to be getting asked, like, how are you doing? Did you end up developing COVID? Did you not develop COVID? So those are all things we're going to have a lot more information in the next 3-4 months to be able to answer a lot more questions in terms of how efficacious the vaccines were, and to really look at, are they able to also prevent transmission? Are they able to also interfere with sort of disease progression or severity? So it'll be a lot more yet to come in terms of efficacy versus efficacious.
Now, a topic that I've been covering for nearly 2 years is misinformation around vaccination. And certainly we've seen a lot of misinformation online about COVID-19 and regulations, government mandates, and it's flourishing on the internet. So my question is, what kind of threat is this online misinformation campaign against the COVID-19 vaccine? Dr. Pan, I know you have a lot of familiarity in this arena as well, so we want to kick this one off.
Sure. The people who are opposed to not only vaccines, the same people are opposed to practically every public health intervention that we have to stop this virus, including contact tracing and mask wearing, unfortunately, have been working hard to spread disinformation about the COVID vaccine even before the COVID vaccine was actually invented. And in fact, we see many familiar anti-vaccine tropes about the COVID vaccine that they've used against other vaccines. So they've very claimed that the COVID vaccine will make people infertile, which of course is not true, but that they made the same claim about like the HPV vaccine, which of course wasn't true then either. Actually, some of them are saying that the vaccines will change people's sexual orientation. And again, there's obviously no evidence or proof to that, and perhaps speaks to anyway. So a variety of different claims about vaccines that are not grounded in facts and the actuality of the vaccine. I think the challenge is that what we've seen with other vaccines is that when people hear these things, it certainly creates some concern or anxiety. For most part, when they have an opportunity to talk to their healthcare provider or other experts, they often are eventually convinced of the importance of getting vaccinated and the actual facts about the vaccine. But the dissemination of this disinformation does require a significant amount of effort on the part of a lot of people, including our frontline healthcare providers, our doctors and nurses, who are already busy enough trying to take care of people with COVID and trying to prevent COVID. And I think we do need to recognize that this becomes a challenge because the experts are already pretty busy just trying to deal with this pandemic. And so when we have disinformation being spread, that unfortunately is also oftentimes accompanied by bullying and threats, not only online, but sometimes in real life. That becomes a particular challenge. So that's a cost that, by the way, is borne by all of us. It's a cost borne by taxpayers and trying to make efforts to combat this. It's a cost that's borne in terms of the amount of effort and time it takes healthcare professionals to debunk these things and answer and to be able to address these particular issues So I think we do have to keep that in mind when we say, well, people should be able to say anything they want, but if it really creates a cost to all of us as we're trying to stop this pandemic that's already killed over 300,000 Americans, it is something we need to think about what we can do to systemically limit the spread of really, frankly, false information.
Dr. Balco, how worried are you about vaccine misinformation affecting the state's plan to vaccinate as many people as possible?
I am very worried about it, particularly this year more than probably prior years, just given the politicization around everything dealing with COVID. It's a little disheartening to see. I strongly encourage folks to actually go directly to the sources, to go and review the information at the Centers for Disease Control website on coronavirus 19, the California Department of Public Health's website. Go and read for yourselves the information, the data. Moderna and Pfizer are very transparent with their data. Their data has actually been posted online. You can find it. It's posted on the CDC website under the COVID-19 vaccine. So I always encourage people to go to sources that they can trust. And while we often want to trust our family members and friends who talk to us, sometimes the philosophy that I live by is trust but verify. I hear what my parents tell me that I'm supposed to do. Let me go make sure that that's what everybody agrees with. And I know where I'm going to go and find that information. And if I don't know where to find that information, reach out to your primary care provider and ask them where you can find this information or see if they can provide it to you.
Now, I'm going back to some of our reader questions. Veronica Daniel on Instagram asked, is one vaccine brand better or more effective than the others? Or in this case, the other, considering there are two main ones right now. Dr. Balco, did you want to start us off on that one?
Sure, I can start. I would say that there is no specific difference between the Moderna and the Pfizer vaccines. They both use similar technology and they both have similar efficacy. The primary difference between the two is that one has to be stored at -70 and the other one can be stored at -20, but that's really the primary difference between them. In terms of efficacy, I would feel comfortable getting either the Moderna or the Pfizer vaccine.
And that's a big key question here is, if I go to my doctor and my doctor is telling me it's probably a good idea to get vaccinated against COVID-19, one of my first questions is going to be, if not my first question, well, doctor, did you get vaccinated or do you trust the vaccine? So Dr. Balco, you said that you would get either one. Dr. Pan, would you get vaccinated from either one of these companies?
Of course, yes. I would get vaccinated. I would get as soon as it's available for me, when it's appropriate. I will certainly, whichever one's available first, that's the one I'm going to get.
Now, I have another more general question before we get into some specifics, but the state has really prioritized equity in its vaccine rollout plan and has talked about the disproportionate rates of infection and deaths in communities of color and among essential workers, particularly the Latino and Black communities. Why is it so critical from both a social justice and then also a logistical perspective to make sure that these Californians are getting a top spot in line? Dr. Pan, do you want to talk to that?
Sure, yes. I would keep in mind that by particularly being sure that people who have the highest rates of infection and who are most vulnerable, be sure that they get the vaccine first. That actually helps all of us, right? Because ultimately, if we can lower the rate of infection in the general community, that's beneficial to all of us, even for the people who are still waiting to get vaccinated, because that means the odds of you encountering someone with the virus is lower. And so that's certainly beneficial. Certainly from a social justice point of view, we need to think about the fact that if people are more vulnerable because of their age, because of their race, because of other medical conditions that they may have, that in order to help protect their lives, I think that those are the people we want to try to afford them the protection of the vaccine first, because they're at most risk of serious harm or even death from the vaccine. And so when we think about our strategies to distribute the vaccine, we want to be sure that people who are most vulnerable to the vaccine, who are most likely to be exposed to the vaccine, should be first. That's why we're starting off with healthcare workers who take care of people with COVID and the inpatient, then working up, then also essential workers, people who cannot avoid being exposed because of the nature of their work or their jobs, and they're doing tasks that are essential for the rest of society. And then we also then need to particularly be sure that communities where there's higher rates of infection have access to the vaccine, and they should come first because of the higher rates in their community. That actually makes other communities also at risk as well, because people don't just stay in one spot, right? They move around, they shop, they work, they do other types of things. And even as we're trying to tell people to stay at home, we know that our essential workers are still going to work. People still need to buy groceries. So we can try to limit that, but we can't eliminate people being able to move around. And so by targeting communities that are with higher infection rates, who are higher at risk, we actually, as we roll out the vaccine, that actually is good for all of us, even those of us who are still waiting to get the vaccine, that we do it that way.
Dr. Belko, is there anything to add on that topic?
I think all of the healthcare organizations in the state and most likely across the country are looking at things in that very lens, exactly as Dr. Pan's pointing out. You're trying to find those staff members that are at highest risk based on what they do, in addition to also based on their underlying risk factors or host factors that might put them at risk, and offer them vaccine first.
Now, very logistically, what happens if someone only gets one vaccine or one dose of the vaccine? Dr. Belko?
Sure. So one dose of the vaccine does provide some protection, but it's not considered to be sufficient protection, because the way that I think about it is the first dose is sort of like the teaser to the body to say, hey, this is something that you need to react to. It's something that we say primes the immune system to kind of look out for something. The second dose is the booster, which actually kind of solidifies the immune response, kind of enhances that memory so that you have some longevity to the immune response going forward. So we really do try to make sure that people get 2 doses of the vaccine. 1 dose may afford some protection, but we still really want to make sure that people try to get 2. There may be times where some folks may not be able to get it exactly 21 or 28 days apart, depending on which vaccine that you're using. And in those situations, you get it as soon as that you can get it. And this is one of those situations where it's all dependent on how the supply is coming out from the different manufacturers.
Do we know how much the vaccine is going to cost? So how much is the vaccine going to cost me, or will my insurance cover it? I think that's a question that many of us will have.
Yeah. So first of all, the vaccine itself is being paid for by the federal government. So the vaccine itself is it's free, but it's being paid for. So it's not entirely free that way, but basically you don't have to worry about paying for the vaccine itself. Now, the thing is that it takes work to give you the vaccine, right? Someone had to store it. There's a health professional who had to give it to you, had to be put in the syringe, and they had to get the Band-Aid and all those other stuff. So what we call the administrative costs related to the vaccine. Under California state law, actually, if you have a health plan that's regulated by California, that is covered as well. So that's part of the Affordable Care Act. We actually included that into state law with a bill I authored last year. So that portion is also covered if you have a health plan as well. And certainly we're looking at what do we do for people who don't have coverage, how do we cover some of those administrative costs as well to ensure that that is not a barrier to people getting the vaccine.
Great. Now, before we turn it over to the reader question, we have a couple of live audience questions here. We have a reader asked a very specific question. If the vaccine is safe for people with Crohn's disease or who are on immunosuppressant medication, do we know the answer to that very specific question?
We have very limited data on individuals who have some underlying chronic inflammatory condition, or some are taking some medications that may suppress part of their immune system. And so far, the data looks like it's safe. Right now, what we're doing is for individuals, again, much like with pregnancy, if you have an immunosuppressing condition or if you are on a medication that is causing you to be somewhat immunosuppressed, we are suggesting discussing that with your primary care provider and assessing risks and benefits. But if you are in an essential career, we are recommending that you get vaccinated. We don't have any evidence to suggest that it's going to cause any harm. We have very limited data so far that suggests that you still mount an immune response in most of these groups. So I think we'll have more data in the coming months. So I would say stay tuned.
We have just a couple final questions, and we're going to go to our audience who's tuned in for this event and has submitted some questions. So Jack Gills asked, what happens if there's a lapse between injections, and if there's a difference between waiting 4 or 5 weeks between doses rather than 3 weeks?
So that's a great question. And the answer is we don't have as much data as we would like. And we know what the companies have studied and we know what is realistic. So that's one of the things that we're going to be looking at in these post-marketing surveys and post-marketing analyses, looking to see when people are getting their second dose of vaccine, how much time has passed, and then evaluating what the responses are in those situations, sort of the real world analysis. We don't have any reason to suspect that if you got the dose at 4 weeks instead of 3 weeks or 5 weeks instead of 3 weeks, that there's going to be a significant difference. The question is, if you got it 6 months later, is there a significant difference? We also don't know that yet, but those are all questions that people are going to be asking and are going to be trying to answer in the coming months.
Mary Stewart said she's a nurse practitioner at a small private clinic that is still treating patients in person. When can she and her staff expect to get the vaccine?
So that's a fantastic question. I would recommend that they talk to their local county health department to figure out where they sit on the schema and to figure out how and when they can get informed in terms of when they can get vaccine. I think that our public health partners are working at sort of looking first at the main hospitals where people are getting treated inpatient with COVID. And then they're looking to branch out to sort of the private medical offices, dental offices, in sort of the second tier.
Dr. Pan, did you have something to add to that?
Yeah, no, I think it's what Dr. Belko said. We're starting off with the hospital, inpatient, and nursing homes, and then going out to the outpatient facilities as well. And I think that communicating with your county department of public health in terms of their plans for getting the vaccines out to whether it's in those individual practices or having those staff go to a centralized site, given the storage requirements, there may be a site that they have them go to in order to get their vaccinations.
Okay. We have a question from Erica. How can we guarantee that our second vaccine or our second dose will be from the same company as our first shot? I think you had mentioned the card concept, Dr. Pan, but let's say you lost it, or let's say I'm just spitballing here, but there aren't enough doses. How do we make sure that there's continuity?
Yeah, so again, as I said, we do give you a card, so you have that for yourself, but also in addition, we're actually enhancing our immunization registry system to be able to handle this kind of information. So there will be a record keeping that the person who administered the vaccine will be entering into that system. So we know that on your first dose, which kind of vaccine you got, so that for the second dose, you're getting the same one. And then, of course, I think, and Dr. Belko can speak to this, I think many of the health systems as well, that electronic health records, of course, will be also keeping that record as well, the electronic health record. So when you give a vaccine, I would make note that if you get any vaccine, we actually do record exactly the vaccine, the lot number, the manufacturer. All of this is actually part of normal practice when we give any vaccine right now. So let's certainly do the same with COVID as well.
Dr. Belko, anything on that?
No, I agree.
Great. Final question, I believe, which is a critical question. And I go every year to get my flu shot. how long should we expect the COVID-19 vaccine to last? Is it going to be a yearly event that, along with the flu shot, I can just expect to get the COVID vaccine, or is this a one and done deal, or 2 doses and done deal? Dr.
That's
Belk,
that's a really great question, and that's one that all of us are sort of struggling with at the moment. Um, it would We are planning on sort of giving the vaccine this year, but it would not surprise us, based on how other coronaviruses behave, that we may see this kind of come back next year in a much more limited phase, as more and more people have become immune, either through infection or through vaccination, and hopefully most through vaccination. And so my sense is that it is still on the table that we may have to do this again next year, but we don't really 100% know the answer to that yet.
And I guess I would just say, I'm not the infectious disease expert, but the coronavirus itself is a virus that oftentimes does not cause long-term immunity, which is why, by the way, that we recommend that people, even if they got infected with COVID, get this vaccine. But this vaccine does target a particular protein, and so the hope is that that the vaccine itself, that this particular vaccine will actually create longer lasting immunity than the immunity you get from actually being infected. But we actually don't know the answer. COVID just showed up, at least we first identified in humans a year ago, or a little less than that. And so we'll certainly be monitoring it and see what's happening, and see if there's a need for additional doses in order to maintain that protection in both individuals and our community at large.
And you just brought up a good point, and I'd like to end here. I said last question was my final one, but this really is my final one. We were not living in COVID times in January and February. What does this vaccine's arrival in less than a year, we're vaccinating people now, what does that say about science, say about the funding of ambitious projects like this? What does this say about where we're at in the medical community?
I would just say is that our experience with COVID shows how important it is for us to invest in the future. So our initial response to COVID was somewhat hampered because of our disinvestment in our public health systems. And I think many people have documented that over the past decades that we have disinvested in public health, the number of the public health personnel, the amount of support public health departments had. But I also point out that this vaccine is based on technology that's been developed for over a decade. If that technology wasn't being developed, we would not have a vaccine being delivered today. So while certainly the vaccine itself for this particular virus, they started the work on this particular vaccine less than a year ago, and it is a miracle of modern science that we were able to have a vaccine this quickly. The only reason we're able to develop this vaccine in such a short amount of time is because the technology that underlies this vaccine was developed through our investments in basic science research. And that's why it's so important that we continue to invest in basic science, that we continue to invest in understanding how these different mechanisms work, because we never know when there might be an opportunity to use that knowledge to be able to protect ourselves and our community against something like the COVID pandemic.
Dr. Belko, anything to add on that front?
I think that was said extremely eloquently, and I wish I could say it just as well.
Thank you so much, Drs. Pan and Dr. Belko. Dr. Pan and Dr. Belko, thank you so much for joining us today. It's really, I feel like we could continue this conversation for much longer, but that's all the time we have for this event. Is there anything else that either of you would like to add before we say goodbye?
Well, I would really just have to say is that we're very excited that the vaccine is here, but it's going to be many months. And I know we talked about this before. Please, everyone, let's do everything we can to stop this virus now. So not just wait for the vaccine to finally be available to everyone at large. So please wear your masks, wash your hands, don't gather with other households over the holidays so we can celebrate the holidays next year with them, hopefully with people vaccinated. But we need to do what we can to stop our hospitals from being overrun over the next several weeks, to keep more people from dying of this virus, and to reduce the amount of virus there is in our community. So each of us has a responsibility to do that. And let's do that now. And certainly, have our fingers crossed that we're all going to be able to get the vaccine, sometime next spring, so that we don't have to worry about this as much. But again, as Dr. Belka said, even as we're starting to vaccinate people, we still need people to do this so that we don't continue to spread this virus.
Dr. Belko?
The only addition I'd like to make is to thank you and show my appreciation for having this sort of venue to answer these questions for the public. I think it's really important to have them have a safe place to ask their questions, to have them answered by an expert panel. So thank you very much for hosting this.
Well,
And
thank
I
you.
too wanted to say,
Yeah,
and thank you myself.
Thank you. It was truly an honor to be able to ask these questions. It's a historic moment for both our state and our country. And I'm delighted to be able to answer questions and talk to individuals, experts like you too. And thank you to our readers for joining our live event and for sending thoughtful questions on this very important topic. I'm Hannah Wiley, a politics reporter for the Sacramento Bee. You can find updated coverage on the COVID-19 pandemic and the state's vaccine plan at sacbee.com. Have a great rest of your day.